सूचना सञ्चार र संवादको मझेरी नेपाली रेडियो क्यालगरी। भाषा, संस्कृति र मनोरञ्जनको कोसेली। यो हो नेपाली रेडियो क्यालगरी।
आदरणीय दर्शक तथा श्रोताहरू, नमस्कार एवं सुप्रभात। रेड एफएम 106.7 मेगाहर्ज तथा फेसबुक र युट्युब लाइभ मार्फत हामीलाई प्रत्यक्ष सुनिरहेको हुनुहुने सम्पूर्ण आदरणीय श्रोताहरूमा आजको कार्यक्रमको प्रस्तुता म रमेशको हार्दिक स्वागत तथा न्यानो अभिवादन। सदा चाहिँ आज पनि हामी यहाँहरूमाझ एउटा विशेष एपिसोड लिएर उपस्थित भएका छौँ। आज हामी के विषयमा कुरा गर्नेछौँ, यहाँहरूको बारेमा हामी छिटै नै आज हाम्रो अतिथि कोहरू हुनुहुन्छ, उहाँहरूको बारेमा हामी परिचय छिटै नै खुलाउनेछौँ। यद्यपि हामीलाई हाम्रो फेसबुक तथा युट्युब पेजमा यहाँहरूले हामीलाई फलो गर्नुहुन्छ भने थाहा पाइ नै सक्नुभयो होला आज हामीसँग यहाँ को उपस्थित हुनुहुन्छ र उहाँहरूसँग हामी के विषयमा कुराकानी गर्छौँ भनेर। आज साउन 2, 2083 शनिबार, तदनुसार जुलाई 18, 2026। आजको दिन क्यालगरी समुदायमा रहेका नेपालीहरूको लागि र इभन क्यालगरी एज अ होलका लागि विशेष रहेको छ। विशेष किनभने आज रहेको छ नेपाली मेला एपिसोड 4। यहाँहरू सम्पूर्णलाई म आमन्त्रण गर्न चाहन्छु। यहाँ हुनुहुने नेपालीहरूका लागि त यो सायद भनिराख्नु नपर्ने विषय नै हो जस्तो लाग्छ। आज नेपाली मेलामा सम्पूर्ण नेपालीहरू क्यालगरीमा हुनुहुने, त्यसका साथसाथै क्यालगरीका आसपास हुनुहुने सम्पूर्ण नेपालीहरू नेपाली मेलामा उपस्थित हुनुहुने नै छ र त्यसका लागि पनि तयारी पनि गर्दै हुनुहुन्छ होला। आज प्रेरी विन्स पार्कमा बिहान 9 बजेदेखि हामी नेपाली मेलामा सहभागी हुन गइरहेका छौँ र नेपाली मेलालाई यो स्थितिसम्म ल्याउनमा यहाँ आबद्ध सम्पूर्ण स्वयंसेवकहरू, त्यसका साथसाथै उत्तिकै महत्त्वपूर्ण रहेको छ हाम्रा स्पोन्सर्सहरूको हो। त्यही स्पोन्सर्सहरूमध्ये हामीलाई टाइटल स्पोन्सरका रूपमा साथ दिनुभएका स्ट्यान्स फिजियोथेरापीका बाट चाहिँ यहाँ महानुभावहरू उपस्थित हुनुभएको छ र उहाँसँग आज हामी हेल्थका विषयमा पनि कुरा गर्नेछौँ, वेलनेसका विषयमा पनि कुरा गर्नेछौँ, त्यसका साथसाथै उहाँको अर्गनाइजेसनका बारेमा पनि हामी कुराकानी गर्नेछौँ। आज हामीसँग हुनुहुन्छ स्ट्यान्स फिजियोथेरापी, काइरो एन्ड मसाज र अर्को ब्रान्च पनि रहेको छ यहाँहरूको डिफ्रेन्ट लोकेसनमा, ओमेगा फिजियोथेरापी एन्ड रिहाब भनेर। त्यहाँबाट हामीसँग यहाँ उपस्थित हुनुहुन्छ भावकिरण कर, अनर एन्ड म्यानेजर, त्यसको साथसाथै गरिमा सिंह, फिजियोथेरापिस्ट एन्ड अपरेटिङ डाइरेक्टर। उहाँहरूसँग आज हामी कुराकानी गर्नेछौँ। त्योभन्दा पहिले यहाँहरूलाई यदि हामीलाई हाम्रो फेसबुक पेजमा यहाँहरूले हामीलाई लाइक, फलो र सेयर गर्नुभएको छैन भने हाम्रो फेसबुकमा गएर नेपाली रेडियो क्यालगरी भनेर यहाँले सर्च गरेर हामीलाई सेयर गरिदिनु भयो, लाइक गरिदिनु भयो र फलो गरिदिनु भयो भने हामी आभारी हुनेछौँ। त्यसको साथसाथै हाम्रो युट्युब च्यानल नेपाली रेडियो क्यालगरीलाई पनि सब्सक्राइब गरिदिनु हुन म अनुरोध गर्न चाहन्छु। त्यसको साथसाथै यहाँहरूका केही सुझाव, सल्लाह र प्रतिक्रिया छन् भने हामीलाई हाम्रो फेसबुक कमेन्ट तथा हाम्रो युट्युब कमेन्टमा पनि हामीलाई यहाँहरूले प्रदान गर्न सक्नुहुनेछ। र अब ढिलो नगरी आजका हाम्रो अतिथितर्फ लाग्न चाहन्छु। वेलकम टु द शो भावकिरण एन्ड गरिमा। इट्स प्लेजर टु हेभ यु हियर। In the beginning of the program, could you kindly introduce yourselves to our guest, Bhavkiran?
Thank you so much for having us. We are in the healthcare professionals and we are serving different locations which help people to recover from pain, injuries and movement limitations. We are helping with different team members and which include the physiotherapist, occupational therapist, as well as the chiropractor, the psychologist, and massage therapist.
Thank you so much, Bhavkiran. It's good to have you here, and thank you so much on behalf of Nepali Radio Calgary as well for being our title sponsor of the Nepali Mela. Garima, could you please introduce yourself, our guest, please?
Thank you, Ramesh, for having me here on your channel. So my name is Garima Singh. I am a licensed physiotherapist, and my passion is to work with patients who are in pain, post-surgical, they need any care in the rehab. My professional journey, it began since 10 years since I passed. So I'm in this care and rehab, upgrading myself every year, helping more people. So that's how I became a physio, and I still like my profession and helping grow through having more businesses so that more patients can access us.
Absolutely. And thank you as well for being our title sponsor of Nepali Mela.
Thank you.
So let's talk about the organization itself. Stance Physiotherapy, Cryo and Massage, and then Omega Physiotherapy and Rehab, which is your different location. What kind of services do you provide, or is there any objective mission behind your organizations? We'd love to hear that, Kiran.
Yes, the mission is to move better and provide all the services under one roof, so that it is more easy for individuals to go to one professional and see other professionals as well if it is needed. Sometimes we also do the service transfers within the team. So if the person came here for physiotherapy, we see that this pain or this issue could be resolved with the help of chiropractor. We just simply refer that person to see the chiropractor for few times as well. So we also do our own work behind that for the clients, to provide them the client-centric needs, so that the treatment is focused mainly on the client needs instead of focusing on the other aspects. So with this one, we provide best services, and the services include physiotherapy, as I already mentioned. So in physiotherapy, we provide evidence-based treatment. So all the treatments are backed up by the research. The most common and most effectively used modalities, which include dry needling, which include the shockwave therapy and laser therapy, all the advanced treatments, they are covered under the same roof. And for the chiropractor, they do adjustments, they provide the education, they provide the postural adjustment, and inform the client how to improve their posture and their activities to reduce the pain and provide them effective management. And for the psychological or mental health counseling, sometimes it is all connected with body and mental health. So they provide us the information that, okay, so this part you are thinking about it, overthinking, or the other aspects which could include stress, anxiety, this is all linked. And then we provide them some modalities which include the cognitive behavior therapy, other techniques which include the relaxation and other psychological modalities which help the clients. So, and same in the acupuncture. So those are the Chinese modalities. They help the client with the somatic care, and they use needling, dry, and the fire cupping. With the help of those areas, they help to reduce the pain, improve the client symptoms, and also they help with the internal systems as well. So some areas which are not assessed with the help of physiotherapy, so they help with that one. They do the treatment for internal organs such as gut health, and also thinking about migraine. Those areas could be treated with the acupuncture. And then massage therapy, they help to relax the muscles. They provide different things such as hot stone, cupping therapy. Those areas they are helping with these modalities and providing the client the best possible care under the same roof. The vision is to use more advanced treatments and upgrade ourselves to help our community.
Thank you so much, Kiran. उहाँले भनेअनुसार उहाँहरूको एभिडेन्स बेस्ड अथवा रिसर्च ब्याक्ड ट्रिटमेन्टहरू हुन्छ। यहाँलाई फिजियोथेरापीले भएन भने यहाँले इन्टरनल ट्रान्सफर गरेर काइरोप्र्याक्टरमा पनि लान सक्नुहुनेछ। त्यसको साथसाथै यहाँहरूको डिफ्रेन्ट मोडालिटिजको ट्रिटमेन्टहरू पनि छ भनेर उहाँले जानकारी दिनुभयो। हामीले फिजियोथेरापीका बारेमा त धेरै सुनेका नै छौँ, काइरोप्र्याक्टरका बारेमा पनि सुनेका नै छौँ, तर हामीलाई यसभित्र पनि अन्य के हुन सक्छन् भनेर उहाँले राम्रो जानकारी दिनुभयो। त्यसको लागि हामी धन्यवाद दिन चाहन्छु। र गरिमा, you said you're in this field, after the education for at least 10 years now. So a lot of people are already familiar with physiotherapy and chiropractor a bit, but they may not know like what it's actually about, why it's needed, because usually like when we think of physiotherapy, it's mostly about, okay, I have pain somewhere, but like Kiran said, it's also related to psychological care as well. So given your experience, this huge experience in the field of physiotherapy, how would you say what kind of things are included in this broad topic of physiotherapy or chiropractor, and Also, while we're at it, Bhavkiran already covered a bit, but I'd also like to know about why these services are necessary and what kind of services do you provide at Stance and Omega.
Yes, thank you. So these the services that we just mentioned, it was quite elaborate. Thank you, Bhavkiran, for doing that. So just wanting to add few things from my aspect would be like the physiotherapy, chiropractic, acupuncture, all these services are part of a care or a rehab approach towards a patient where we would help in getting more mobility, restoring their function, and preventing further injuries. So the typical notion of getting what is a physiotherapy is not only when you have pain then you seek help. It is always important to avoid that kind of pain to seek help too. So it's important to get to a point where you are preventing your injuries. If you are, for example, a sports person, why we need to wait for any ligament injury? We can start stretching, we can start strengthening our joints to prevent those injuries. So the more we know about prevention, the better we can take care. And a physiotherapist or a chiropractor or other therapist professionals, they are best people to guide them because they can provide an individual based treatment plan, very personalized approach, and depending on that subject, like one-on-one, this is what the assessment tells us, like, okay, you have a posture issue, or you have a weak quadriceps, or you have like gait problems, or there is a balance issue. For seniors, there are a lot of falls, so we can prevent falls. So the more people are aware about it, the more we can help them, not only treating the injuries, but preventing them too. Yeah.
Thank you so much, Garima. I think you covered an important topic about prevention. So like you gave an example of an athlete, why wait for the ligament injury when you can prevent it maybe by stretching or doing some exercises. Yep. उहाँले निकै नै महत्त्वपूर्ण कुरा गर्नुभयो. हामीले जेनरली फिजियोथेरापी भनेको चाहिँ हामीलाई केही पेन भयो अथवा हामीलाई शरीरमा केही समस्या आयो फिजिकली भने जाने विषय भनेर हामीले सोचिरहेका हुन्छौँ, तर कतिपय केसमा चाहिँ उहाँले भनेअनुसार यो प्रिभेन्टिभ पनि हुन्छ. यहाँहरूले अगाडि नै स्ट्रेचिङहरू गरेर आफ्नो शरीरलाई नै इन्जरीबाट अगाडि नै प्रिभेन्ट गर्न सक्ने पनि स्थिति हुनसक्छ. त्यसैले यहाँहरूले केही डिफिकल्ट टास्क गर्न चाहनुहुन्छ भने चाहिँ गरिरहनुहुन्छ भने यस्ता एक्सर्साइज अथवा यस्ता गतिविधिहरूले अवश्य पनि इन्जरी प्रिभेन्ट गर्न सक्छ. यो हामीले देखिरहेको सुनिरहेको कुरा पनि हो, तर त्यसको साथसाथै अब फिजियोथेरापीकै विषयमा हामीले कुराकानी गर्दाखेरि चाहिँ फिजियोथेरापीभित्र पनि यस्तो पार्टहरू पर्छ भनेर आज उहाँले बताउनु नै भयो. अब अलिकति हामी फेरि पनि अब हेल्थकै विषयमा अलिकति कुराकानी गर्छौँ. So mostly physiotherapy, like you said, it can be preventative as well, or it can be done after some injury and pain as well. Mostly, what do you think? Who can benefit from it, or are there any age limits? Who can, for example, seek physiotherapy care, or basically, like your organization, does it provide care for everybody? So can you talk a bit about that? Maybe Bhavkiran, and if you'd like to add, you can add to Garima. Yep.
Yes. So thank you so much. I just want to add the physiotherapy is for everybody. We need the physiotherapy for at every stage of life. Sometime for the kids, when we think that their knees are not straight, they are not walking properly. During that stage, we are helping them to learn to how to walk properly. So that area is known as gait. So we do the gait analysis. We make the person walk in front of us and see what are the aspects. For example, somebody is touching the ground too early, which give us a awkward movement. So we will stretch that muscle and see if that muscle is weak, then we provide them the strengthening exercises. It is basically based upon the person. And for the teenage kids, now they are using a lot of device. Sometimes they don't take care of their own posture. So we see a lot of forward head posture. So for that one, we need to educate them. Otherwise, it will be a bigger problem in their future. So in those areas, we provide them the education about their posture. And for adults, which we see that they're working for full time and mostly the desk job. In those areas, because of the sedentary lifestyle, same postural issues are there. But these postural issues also bring pain this time. They have pain in the neck and back. Sometimes it's not just the pain, it is the tightness. So we need to think that what is causing that tightness. We provide them education, we provide them stretching and strengthening exercises to correct the posture. If we have any injury, for example, we went for a walk, we sprain our ankle, and those areas we are treating on regular basis. And low back pain because of the work, because of our lifestyle, those areas we are treating on regular basis. And for the females, they have many issues. For example, pre-pregnancy. So we have to prepare their body sometimes to make sure that they are in a good shape to conceive or to give birth. And during the pregnancy, we need to help the females to correct their posture, because there is forward head posture, and the gravity and the body weight is playing a major role in that one. So we need to help the females to correct their posture, and specifically during that time they need help for the pelvic health. So making sure that they are not having any pain, making sure that their ligaments are strengthening, so that it will help them for the childbirth. And after the childbirth, they have a lot of physical changes which cause significant issues within their body. So for that we provide the care. So there are after pregnancy care, we provide the pelvic health. Garima is one of them. So she had the certification, a lot of experience, maybe 5 years or more than 5 years of experience in pelvic health. So those areas. And then it comes to the older population. They have lot of falls, as we already mentioned, and then weakness in the body parts, so which may cause a lot of issues such as mobility issues. They are hesitant to walk outside their home, they are hesitant to go for the major events. So education and providing them some exercise plan which are very easy for them to follow, and providing them care, and maybe just giving them the information that this is important. It is. So we provide those services. Garima can elaborate more on that one.
Absolutely, Garima.
Yeah.
Meanwhile, also I like to add a question to it as well. Vavkiran already covered most of the topics, but from your personal experience, like you said, you had more than 5 years experience for women healthcare. So probably related to pelvic issues, pre and post pregnancy. What kind of issues that you most commonly face when you are offering these services? So can you also touch base on that as well while you are elaborating on that topic?
Sure, yes. So I'll start with the pelvic physio first. So as a pelvic floor physiotherapist, we take care of them at every stage of their pregnancy and even postpartum, depending on they are first trimester, they are second trimester or third trimester. There are so many issues that can be found with the ligament pain, lower back pain, groin pain, some nerve tension going down the legs, swelling in both the ankles, then trying to, adjust to that new center of gravity which you're like growing with each month. So all these aspects are covered by a physiotherapist, where they would assess and train them accordingly if they are a high risk or a low risk case. So depending on that, the exercise plan is planned for them as an individual treatment plan for the trimester wise. We have different exercise for first trimester, second trimester, using more of the ball, using more of the active rehab. They can use some sacroiliac joint bells to support their lower back pain. They can use some ankle foot exercises to reduce their swelling, some kinesio tapes, they help with the lower back pain. So all these are really important for them, because this needs to be done on a daily basis to help improve their posture and pain. Post-delivery, depending on the type of delivery, if it's more like a surgical or a non-surgical approach, whichever way the patient has gone through, there is some kind of pelvic floor weakness in the muscles. There will be your core muscle weakness, because that's where the diastasis recti, which is one of the most common abdominal separation that is common in females post-delivery, sometimes even during the delivery, that can happen. And taking care of that it is important because many patients, they don't know with a separation of their abdomen, they can have a severe back pain, and resolving takes very long time, because the more we delay the treatment, the healing is again longer. So it's important to get that approach. Like even with hospitals also, they do have the pelvic floor physio, which right after post-op day 1, they have that session to educate the client with pelvic floor strengthening, with watching their diastasis, and how to take care of, as a new mom. Because as a new mom, postural issues come into role, where starting the feeding and all the process of just understanding how to carrying and handling the baby. So we need to educate them with how to, hold the baby and not give yourself like forward head posture. Don't bend your neck down, because it's like, feeding multiple times in a day. So by the end of the day, you're already tired, exhausted, and like a bad posture. So physiotherapist role come into that. Apart from that, going more deeper with older people in the pelvic health, which is especially postmenopausal. Postmenopausal, they have like a lot of prolapse issues. They have incontinence issues. So incontinence means you're unable to hold your urine, or difficulty using washrooms a number of times. You're having that urge. And then there could be some kind of prolapse, which could be like your bladder prolapse, your any pelvic organ prolapse. So that can be helped with, again, the pelvic floor strengthening, along with sometimes like if they need pessary fitting. So I do the pessary fitting too. So we can help with these issues as a pelvic floor physiotherapist. Adding to more stuff with the previous ones, that would be, yes, physiotherapy in itself has grown through a wide variety, like in various aspects, not only musculoskeletal, like not only arthritis, lower back pain, ligament injuries, but it has also, you will see the physiotherapy in neuro rehab, so a post-stroke, hemiplegia, any spinal cord injury patients. So all these are, like the physiotherapists, they play a regular role, which is mostly like common, and getting better into the neurological rehab. Cardiac unit, if there will be a physiotherapist performing chest physiotherapy, especially here we have, like there are so many pulmonary or lung issues that we have seen. So teaching correct cuff technique, preventing lung infections, especially pneumonia, COPD, asthma, all these, they need a separate kind of breathing training to avoid the shortness of breath episodes. So not only one thing, we are there for everything, wherever we can have our scope and help patient get faster approach, and we are like, don't have to wait. So that way, at least they can get something to get better with their recovery.
Absolutely. उहाँले भनेअनुसार फिजियोथेरापी कुनै एज ग्रुपसँग सीमित पनि हुँदैन, यो सबै एज ग्रुपका लागि पनि हुन्छ। त्यसको साथै स्पेसली हामीले देखिरहने स्पेसली महिलाहरूको समस्या भनेको प्री प्रेग्नेन्सी र पोस्ट प्रेग्नेन्सी आफ्नो बडी चेन्जेसहरूले गर्दाखेरि जे समस्याहरू आउन सक्छन्, त्यो विषयमा पनि थुप्रै रूपमा फिजियोथेरापीले हेल्प गर्न सक्ने पनि कुरा गर्नुभयो। त्यसको साथसाथै बुढेसकालमा पनि हामीले देखेकै हुन्छौँ थुप्रै समस्याहरू हुने गर्दछन्, र फिजियोथेरापीले पनि त्यसमा कसरी हेल्प गर्न सक्छ भनेर हामीलाई दुवैजनाले एक्सप्लेन पनि गर्नुभयो। You touched based on a small and an important thing to get the treatment or the physiotherapeutic treatment as soon as possible after, for example, if you have an injury or if you have any problems with your body. So why is this immediate care important, or why is it important to seek help immediately in such cases, and what can be the long-term impacts if these treatments are not done in time? Could you please elaborate on that? Maybe. Yeah.
Sure. So first of all, yes, if the treatment is not, like if you don't seek care right after, like even if you have the injury, or where if we say, okay, I'm having some kind of shoulder pain, for example. So if my shoulder pain has started like 1 week ago, why to wait for 2 weeks, 3 weeks, and keep managing in other ways, which maybe it's just hit and trial and not getting anywhere. So we are just wasting time, because if our shoulder maybe have started with just rotator cuff pain, which is one of the important muscles to stabilize the shoulder, then after 3 weeks, it doesn't stay just rotator cuff pain, because the human body, it starts to compensate. So then your upper traps, your neck will start to protect that shoulder. So by the end of 4 to 6 weeks, if you're seeing a therapist, oh, the pain did not went away, which started 6 weeks ago, has the list of problems is long. So when the list of problems is long, then we are treating most of the stuff. So retraining the brain with so many things at once can, take time. When we are going right away, we are just focusing on that acute inflammation stage, which is very easy to go back to that normal recovery, which has a faster timeline to control the inflammation, and then patient can be more aware to avoid. Now, how to avoid is depending on the cause, depending on a posture assessment, a detailed assessment which involves for sure the posture, the weaker muscles, the shorter muscles, and the type of work they do at home or at work. So all these can devise a plan for them to avoid, because there are certain techniques to avoid shoulder injuries, avoiding certain provocative movements. For example, we would say don't do too much of that external rotation and abduction movement. That can again affect your shoulder joint. So how to do it, how modified versions of it. So we teach as a therapist how to work along that plan where they can prevent future injuries. Now, the complications are worse if we don't take care, because then just one kind of pain becomes a more complicated kind of pain which never goes away. That's what we have trained our brain, that this body is normal to stay in pain for so long. So to re-trigger and to rehab the whole cycle takes another time. So sometimes we are expecting, we want to get better right away, but that expectation doesn't last long because we have taken that time to seek care.
एब्सोल्युटली थ्याङ्क यू सो मच गरिमा हामीले जेनरली सोचेका हुन्छौँ कि कुनै पेन भयो भने छिटै नै जान्छ होला भनेर, तर उहाँले भनेअनुसार कहिलेकाहीँ हाम्रो ब्रेनले नै त्यो पेनलाई काउन्टर गर्नको लागि अरू अरू शरीरका पार्ट्सहरूले पनि युज हुने हुनाले त्यहाँ पेनहरू अन्त पनि फैलिन सक्ने हुनाले उहाँले भनेअनुसार यस्तो केसेसहरूमा अगाडि नै यस्तो केयरहरू लिँदा राम्रो हुन्छ र त्यसका साथसाथै पछि लामो समयपछि गर्नुभयो भने चाहिँ फेरि बडीलाई माइन्डलाई रिट्रेन गर्नु पर्यो, त्यो कुराहरू एडप्ट भइसकेको कुरालाई फेरि रिसेट गर्नु पर्यो, त्यसका लागि पनि लामो समय लाग्न सक्ने उहाँले बताउनु भयो। र त्यसका साथसाथै हामीले कतिपय कुराहरू त नबुझिकन गलत तरिकाले गरेका पनि हुन सक्छौँ। त्यसैले एउटा प्रोफेसनल हेल्प लिँदाखेरि चाहिँ उहाँहरूले गाइडेड रूपमा समस्या क्या हो बुझेर उहाँहरूले समस्याको समाधान गर्नु कुरा पनि उहाँले बताउनु भयो। Now let's talk a bit about the chiropractic care. Usually chiropractic care is often misunderstood. Maybe some people don't know what exactly the chiropractor do or who should consider the chiropractic treatment. Could you please elaborate, like what is chiropractic care and why it is important, and what kind of people can seek chiropractic treatment?
Chiropractors are generally the doctors of bones, so they help us to see the bone structure. Sometimes they request the x-rays and see if there is bone issues or any gaps within the spine or there is any misalignment, so they help to correct with the alignment. So basically they work with the bones and try to adjust the bones accordingly. So they perform a lot of cracks, as you already know, everybody. So it's not just limited to the cracks. So they have a very huge part to play. So one thing include a lot of adjustments. So they provide the education, they do stretching, they provide information about different techniques to different clients depending upon their needs. So for example, if a person is having the hip pain, so the hip pain could be connected with the spine. So they need to see if it is the nerve injury or there is any issue related to the muscles. So depending upon the person's symptoms and depending upon the person's needs, they are going to adjust it. So basically they provide education, provide techniques, and do their own manual work for mobilization and for adjustments to provide the care for the person.
Absolutely. Thank you so much, Kiran. Garima, would you like to add anything to that based on your experience?
So based on my experience, we always try to treat a patient as a whole and try to provide services depending on every therapist has, or every therapy has its own limitations and boundaries to perform certain techniques. So as a physiotherapist, we perform basically mobility training, pain management, prevention, education, a detailed assessment. That's a major part of a physiotherapist role. As a chiropractor, they help in realigning the body's posture and the mechanism, where that can help a physio to teach a proper body mechanics, because the spine has been adjusted and muscles are back in their place. So it's easier for a therapist to work on the muscles and teach a patient, because now the spinal reflex has triggered and the brain now can understand better, rather than just keeping stretching a shortened bone but the bone is not aligned. Then there is like another therapy, acupuncture, where it's a direct approach, where we can, directly insert needles, the acupuncturist, right into the spot, getting more positive energy, more holistic approach, treating not only the muscle issues, but also treating more energy balance. The other is massage therapy. So it's a registered therapist. They provide certain soft tissue techniques or deep tissue techniques, depending on what benefits the client in a rehab. For example, some people, they are really tight, they are really high in muscle tension because of the injury. So they really need to work with deep tissue techniques, which could be like deep cupping, which could be gua sha, which could be active release. So all those techniques can assist in getting more blood circulation and getting its more flexibility. Then come the psychological aspect. The psychological aspect is when all the physical balance is there, then we need to balance the emotional or the mental side too. So then it becomes a complete cycle of healing for the patient, because of the pain for so long. The patient is also affected mentally on a daily basis at work or at home. So it's like a full approach. So that's what we provide, so that a patient is not missing on any links, and if needed, we are there and we can help, so that they are not like, okay, we're just having physio here, let's find some other practitioner because I need seek help.
Thank you so much. I think you explained very well, because typically when we talk about physiotherapy or chiropractic care or even massage, we mostly think about, okay, it's related to our physical body. We are fixing some muscle issue or some bone issue. But from our conversation today, I think a lot of our audience will understand it's not just about physical health, but also psychological health, because a lot of things are connected to the brain, and the brain adapts to how your muscle is at the current state, and then that can also sometimes, when brain adapts to some physical problems, later it becomes a big issue to fix both physical and the mental issue. So thank you, Garima, for explaining it very well. Now let's talk a bit more about massage care also. Usually when we think of massage therapy, we think about relaxation, or we're just relaxing our body, but I definitely think there is much more to that. And how does registered massage therapy work, or how can it help with, for example, pain management or recovery, or are there any more aspects to it? Bhavkiran, would you like to add to that?
Yes. So when we think about massage, we need to think about the muscle structure as a whole. So the massage therapist generally check the body. So they do the assessment, and on assessment they see which muscle is tight and which area is weak. If there is any tightness which is linked with the tightness of the muscles or with prolonged posture, somebody is overusing their body part, one side more as compared to other side. So they need to see that, okay, they are not using left side, for example, because there was a previous injury in the left side. So they can see that there is some weakness on the left side, but on the right side there is overuse. Because of overuse, the muscles are obviously very strong and they are overworked. So because of that, they work on those areas. They provide the relaxation technique for the overused muscles, and they do some stretching exercises. And if there is any knots within the muscles, so they try to release those knots, and they help the client to relax a bit more. And also for the relaxation of the knots, they use different techniques. They use the hot stone so that it's not that painful for the individual. They use sometimes the cold stones if it is because of the injury, they help to release that knots with the help of cold stone, and also use cupping therapy. With the cupping therapy, it helps them to increase the blood circulation to that area, and with increase of blood circulation, they lift the fascia apart from the bone, which help to release the toxic elements which are accommodate underneath the skin. So help to mobilize those particles, increase the blood circulation so that the blood flow is moving and the person is recovered. So everything doesn't work in a magic in one day, but we need a consistent help for that one, and we need to work towards a wellness on a consistent and daily basis.
Thank you so much, Vavkiran. Garima, so being a professional physiotherapy, of course, you have a lot of idea on these topics, and I think most of our audience are not very very familiar with the terms that we use today. Or, for example, what is basically acupuncture. We were talking about cupping therapy, and also there are dry needling and shockwave therapy. So, could you explain like what are these, and when can it be useful to someone who is looking to do these types of therapies? And also, meanwhile, when we are talking about these kind of therapies, can somebody do these therapies when they are not, they do not have any issue? Also, for example, like massage is something people can do even when they do not have any issue, for getting their body better or helping themselves with their muscles. So let's talk about these topics a bit, and also when someone should use these, or if they can use it even they do not have any issue. So yeah, Garima, let's talk about that.
Yes. So when we are talking about the shockwave, laser, cupping, dry needling, so all these are different modalities to work on a particular body. So when we are working on a particular body, it's not like we are using everything on them at one time. Depending on what is the assessment, what is the diagnosis, what is the current situation, what stage are you in. For example, if you have a recent ankle strain, which is very acute, you had a fall and it's like super swollen, so the first step is you're coming day 2, ankle swelling and ankle injury. So the first goal is important to address is the reducing the swelling, reducing the pain and inflammation. So at that point of time, any anti-inflammatory or any ice pack that we use for controlling the inflammation, we won't go in for and do the shockwave at that point of time, making things worse. So it's important to identify the stage of the issue. If the same ankle pain with same swelling, but it's way chronic, like 6 months ago I injured, so the body has healed like that, which has been not strong enough at today's date. So at that point, there would be certain scars, certain adhesions, which can be taken care by shockwave therapy, where it's working on the tendons and ligaments to break down the scar and adhesion, to recreate and regenerate the healing of the tissues. So depending on what stage, these modalities can be used. So there is like ultrasound therapy, laser therapy, shockwave therapy, there is dry needling, there is muscle stimulation, heat pack, ice pack, static cupping, dynamic cupping, because not everybody is comfortable with every modality, right? For example, somebody will say, I suggest, okay, yes, you need needles. Can I do dry needling on you? Explaining all the benefits and risks and everything. But then the patient might not want needles. Maybe he's or she's scared of the needles. So I don't have to impose my opinion on the particular body. It's like, okay, there is an alternative. So the alternative could be more tolerable than the actual needling, right? So then shockwave therapy can be a part of it, or a more gentler approach where ultrasonic therapy, where you don't feel much, but still it's working in the deep tissues, working on the tissues, getting that osmosis process and moving away the swelling. So there are different ways that we can help a person, even with no modality. If we know, okay, depending on how many sessions a patient is coming for, we would for sure work on okay, if you're coming for 2 sessions, let's get you set up with a home program so that you can self-manage, so that you're also not dependent on therapy. So the therapist role is at every point, depending on what a patient needs. If a patient needs aggressive rehab, we are there. So we will work with the modalities because there is certain protocol that we need to follow to see the benefit. It's not one day thing. Then exercise to help maintain whatever we have achieved. So that is important for that is where we use different modalities in a physiotherapy approach.
Thank you, Garima. Now let's talk a bit about something that most commonly happens, and someone might need to seek physiotherapy or chiropractic care. So usually, most often we mostly see motor vehicle accidents, and mostly in many of the cases, sometimes the pain doesn't come right away, but appear after a certain period of time, and then most of them are recommended to the physiotherapy care. Let's talk about why or what should someone do. So, for example, if they have an accident or if they experience pain, even if it seems minor, and given your experiences, how often do you see these kinds of issues, and how do you handle these kind of issues? Maybe Fafkiran.
Yes, thank you so much for discussing such an important issue. The motor vehicle accidents is really common, and sometimes we ignore it. It was just a small impact, but sometimes the small impact give bigger impact towards the body. So it is a whiplash injury when the neck goes forward, backward, and again forward. So during those areas, if the person is having the pre-existing issues, the issue is more, and sometimes they have the head injury, and with head injury they have a lot of issues such as concussion. So with concussion they have difficulty to focus, they have difficulty to follow the track of thoughts, and they have brain fog. The thought process is not very clear. The person is having the sleep issues. The person is feeling not very much of himself. So those issues are common. And the other aspect is when we saw an accident happening or we saw something is coming, we clench our teeth. With the clenching of teeth, we have the tightness in these jaw issues, and because of that issue, whenever the person is sleeping or whenever the person is unconscious, they are clenching the tissue again and again. Maybe they are thinking about that incident, maybe the impact is still there, and because of that they have a lot of jaw pain. It causes a difficulty to talk, they have issues to eat. Sometimes those issues, they don't go away by themselves. We need some treatment for those areas. And the motor vehicle accidents, injuries, they are covered by the insurance, so we don't have to pay anything out of our pocket. So these are the neck and the head issues. Because of the motor vehicle accident, we have the neck and low back pain as well. So with that, we provide them the physiotherapy treatment based upon their muscles which are more involved and the area which are more involved. We provide exercises, we provide modalities, we provide the home exercise program to educate the person and to provide them the overall health. So that the impact is there, but it will be reduced with time. And we make sure that our muscles are more recovered and that they are more strong so that they can handle these impacts. And very important aspect other than the physical aspect with the motor vehicle accident is the mental health. So when we face an accident one time, two time, so we are scared because of that. Sometimes we are going for a driving, so we have the fear of driving, even the passenger. So they feel they are thinking again and again somebody is going to hit us. So those those issues, they are impacting their sleep, their quality of sleep, and also giving them some mental blockage so that they are not going to recover from it. It takes a lot of longer time as compared to helping with the professional. They will provide small techniques such as exposure therapy with the help of the psychologist or mental health counselor. They provide some techniques to gradually adapt to those areas or those needs which are needed. But when we are not seeking any professional help, so this part is still there, but we have to keep moving in our life. So the person may get bigger impact, so that the person is very stressed. We don't know where the stress is linked. So I think we need to seek counseling and the psychological services for those areas as well. So the physiotherapy part is there, but it causes a lot of bigger impact on the overall body. So we need to consider overall body as a thing, so that we can approach different areas and we can provide different care according to the body needs.
Absolutely. I think, you covered a very important point. Usually, in most of the cases, we don't even realize we have the issue because of some sudden movements or, like you said, sudden physical changes. उहाँहरूले भनेअनुसार हामीले कतिपय केसेसहरूमा आफूले पनि रियलाइज गरिरहेका हुँदैनौँ हामीलाई के समस्या आइरहेको छ, स्पेसली मोटर भेहिकल एक्सिडेन्टमा जब चाहिँ हाम्रो बडी सडन चेन्जेसहरूमा जान्छ। त्यसको साथसाथै उहाँले मेन्टल्ली हुने इस्युजहरूका बारेमा पनि कुराकानी गर्नुभयो। आई थिङ्क त्यो इन्फर्मेसनले हामी सबैलाई पनि कुनै पनि यस्तो केसेसहरूमा मोटर भेहिकल एक्सिडेन्ट मात्र नभएर सडन कहिलेकाहीँ अन्य गतिविधिहरू गर्दाखेरि पनि हामीलाई रियलाइज हुँदैन त्यसले के असर पारिरहेको हुन्छ। त्यसका बारेमा पनि प्रोफेसनल हेल्प सिक गर्दाखेरि चाहिँ बेटर हुने कुरा उहाँले बताउनु भयो। Now let's talk about other things that we most commonly do, especially in Calgary or Alberta. We like to do a lot of outdoor activities. We go hiking, we go skiing, we go running and everything. Also, the other most common thing is these days are a lot of people sit for long hours on their desks working, and then definitely they do not realize it immediately, but in the longer term, it is causing some effects to your body. So as a preventative care, or even someone who seeks help afterwards, what do you recommend? For example, how do they take care of their body when they're working or doing these activities? Could you please elaborate on that, Garima?
Yes. So depending on the level of activity, whether you're hiking, whether you are swimming, whether you are going on a long walk, or even just sitting at the desk and working 10 hours.
Mm-hmm.
So at every point of time, or each activity level involves some kind of muscle work, some kind of body mechanics, which needs to be more aware of. So one needs to be more aware of. If for a hiker, I would address issues of having muscle flexibility is more important. Joint ligament sense, which is like a proprioception or balance, is very important to avoid falls, to avoid injuries. Because when you are hiking, you're hiking on uneven surfaces.
Mm-hmm.
You're never hiking on a smooth trail most of the times. Then if you are a swimmer, I would suggest, go ahead and swim, but have a more upper body and shoulder mechanics, which is important at that time. Then for a computer worker, or for an ergonomically based system is there or not. For example, if you're working at a desk, if we want to see, is your chair too high from the table, and you're just poking your chin out in the computer. So the appropriate mechanics in terms of how you're sitting, are your feet supported, are your elbows supported on the forearm, your neck and lower back, how they are aligned in a chair, is your back supported, or if you are a unsupported sitting, sometimes people do have rolling stools to sit on, to how to have that balance of center of gravity still with no pain. So in terms of prevention, which is more beneficial to avoid injuries, and then staying home, getting healed, and then getting back to that activity, is more important to prevent it rather than treat it. So treating is still there, yes, because of the muscle imbalance, there would be some kind of pain, there would be some kind of loss of flexibility, there could be some kind of, muscle imbalance, and muscle would have that, they don't have that muscle memory left anymore. So that way, because that becomes habitual, if we keep sitting like that, we don't feel it until there is pain in our body. So if we are slouching and sitting, we don't want to wait for the pain. Be aware of it beforehand. Try to have that shoulders aligned. Try to have that chest out position. Try to be your neck aligned, chin not out. So that can help for longer run, because that is also not putting undue pressure on the spine with time.
Absolutely. I think in most of the cases, we don't even realize, we just do things, and there are very long-term impacts down the line. And it's always better to do preventative care then have issues and then go after treatment. Talking about this, so how often, because in most of the cases we don't even seek for example physiotherapy care because we think we are all right, but it's always to have your muscles relaxed or muscles in a good shape and position, and even the bones. So how often, so for example, for a regular person who doesn't have an immediate need, who doesn't have an immediate issue and need help immediately, what kind of preventative care, or even just for relaxation, what kind of care they can take when they are in not in an issue phase, let's say, and what kind of services do you offer for those kind of services, and then also what are the most often services that people seek when they are for example when they are in a regular state, not in some injury or having any health issues. So can you please elaborate on that? Maybe Kiran and then Garima can add to that.
Yes, thank you so much for addressing such a common and wonderful issue. So one thing is that we all are working mostly here in Canada, and because of that we have a lot of issues. Even the truckers, those who are sitting for longer run, and they are the drivers who are sitting on a longer run and they are on the road, and there is small shocks within the body because of the road and because of the friction of the road. So there are some shocks which also impact our spine. In the longer run, the cushion system in the spine is also impacted. During those areas, we need to make sure that we are doing a regular stretching, we are getting some time off from the work, and just to make sure that our mind and body is getting relaxed. Regular exercise is really important. Regular stretching exercises are really important, and making sure that we are working on our core areas, which is the stomach area. So working on those parts also prevent many problems. And this is for those who are driving for longer time, and for the work. Many individuals who are working in warehouses or in other areas, they have to provide do a lot of lifting. So maybe lifting techniques for proper lifting techniques are really important to prevent further injuries. When you came to physio, you will tell that, okay, I'm lifting a lot of weight and doing repetitive exercises or repetitive work duties. So in those areas, we will address those muscles who are keep on working, and maybe trying to give them stretching exercises, some relaxation techniques, and providing some strengthening exercises to make sure that those areas or those muscles are strong to prevent the further injury in a long run or in the short run. So those areas are important. And another aspect, which is overall health. So making sure that you are going to physio whenever you don't need it. Sometimes it's just for the overall health, making sure that my body is doing proper work. So sometimes we can see it as a professional with our own vision that, okay, this area is going to be affected in after 5 years or 6 years. So we can just give you some exercises to prevent those changes, the bodily changes which are coming in future.
Thank you so much, Kiran, and I think you explained pretty well on why someone should seek physiotherapy or different cares that you provide, even when they are not having any issue immediately, but could have in the long run. We're coming at the end of the program. I didn't even realize how this hour went by, and we're very glad to have such an informative session with you. Also, now let's before we end the program, let's dive into the another topic. So as we already know, and most of our viewers already know, Stance Physiotherapy, Chiro and Massage and Omega are our title sponsor for Nepali Mela and Multicultural Showcasing event Nepali Mela 3. And just want to talk about what motivated your organization to support our cause and how important it is for local businesses like you to support or give back to the community. maybe Vavkiran and then Garima.
I think community sport is really important. If we help each other and build each other for the future and to work together, it will be really good for our community, and it is also important for our physical and mental health as well. So working together as a team and lifting or going towards future is really important. Uplifting each other is really important aspect as per me, and Garima can add more.
Yes, I've always favored multiculturalism, because then people have more options to seek help, because sometimes, when you see something which you can easily talk to with some practitioners or healthcare professionals, you can easily share your pain, you can easily share and, tell your all issues. So then half of the pain is gone at that time only. So that way I think it's really good, and getting involved with different communities, and especially like the Nepali community. I think thank you for hosting us and this show and calling us and getting our insight for how this whole system works. And we are there for you and for everyone. If you need any kind of services or we are approachable, and yes, and yeah. Thank you
while
so
we're
much.
at
We don't
it,
need any referrals.
Absolutely. And while we're at it, could you also tell if somebody wants to book an appointment or reach out to you, what can they do?
So there are, many ways. You can go to the website, you can book online, you can give us a call, you can email us. So there are so many ways that you can reach us. And we are there on the online website is there. So it's www.omegaphysiotherapy.ca, and the website for Stans.
www.stansphysiotherapy.ca.
Okay. Thank you so much. And also thank you so much for being the title sponsor of our Nepali Mela episode 4. And it's happening today. I think everybody is getting ready to go to the Nepali Mela, and we'd also like to see you on Nepali Mela, and we will definitely. And again, thank you for being with us here today. I think this has been a very informative session about physical health, mental well-being, and definitely I hope all of our audiences had taken some good information today. And once again, thank you so much for being with us. Today here. श्रोताहरू, हामी आज कुरा गर्दै थियौँ हाम्रो नेपाली मेला 4 को टाइटल स्पोन्सर स्ट्यान्स फिजियोथेरापी, काइरो एन्ड मसाजसँग, र त्यसको साथसाथै उहाँहरूको अर्को लोकेसन पनि रहेको छ ओमेगा फिजियोथेरापी एन्ड रिहाब भनेर। हामीले विशेष गरेर उहाँहरूको अर्गनाइजेसनका बारेमा कुराकानी त गऱ्यौँ नै, त्यसका साथसाथै हामीले मानिसका लागि सबैभन्दा महत्त्वपूर्ण कुरा हुने नै भनेको हेल्थ हो, र त्यसैका बारेमा हामीले विस्तृत रूपमा चर्चा पनि गऱ्यौँ। फिजियोथेरापी, काइरो, मसाज थेरापीदेखि लिएर अन्य विभिन्न थेरापीका बारेमा पनि हामीले कुराकानी गऱ्यौँ, र यसको निड, यसको इम्पोर्टेन्स र कसले चाहिँ यसको सुविधा लिन सक्छन् भनेर हामीले कुराकानी गऱ्यौँ। र यदि यहाँलाई यो सर्भिसहरू चाहिन्छ भने अवश्य पनि स्ट्यान्स र ओमेगामा यहाँहरू जान सक्नुहुन्छ। र यति भन्दै हामी आज कार्यक्रमको अन्तिम चरणमा पुगिसकेका छौँ। सर्वप्रथम त म यहाँहरू सम्पूर्णलाई धेरै धेरै धन्यवाद दिन चाहन्छु, र यदि यहाँहरूको कुनै सुझाव, सल्लाह र प्रतिक्रिया छन् भने हामीलाई अवश्य पनि हाम्रो फेसबुक मेसेजमा यहाँले मेसेज गर्न सक्नुहुनेछ। हाम्रो प्रोग्राम यहाँले युट्युबमा पनि हेर्न सक्नुहुनेछ, फेसबुक र युट्युबमा यहाँले कमेन्ट्स पनि गर्न सक्नुहुनेछ। र फेरि पनि अर्को साता हामी नयाँ विषयवस्तु लिएर नयाँ अतिथिका साथ उपस्थित हुने नै छौँ। तबसम्मको लागि आजको कार्यक्रमको प्रस्तुता म रमेशलाई पनि बिदा दिनुहोस्, र साथसाथै आज नेपाली मेला पनि रहेको छ भनिराख्नु त नपर्ला, यहाँहरू सम्पूर्णलाई जानकारी छँदैछ। त्यसैले पेरी विन्स पार्कमा अब हामी सबैजना त्यहीँ भेटौँ। धेरै धेरै धन्यवाद।
Thank you.